In the studio is the Health Minister, Mr. Kobadamika Akando. Mr. Akando, you welcome.
Thank you.
And it's really good to see you.
Good to see you too.
Congratulations to
Thank you
on your elevation.
Thank you.
All right. So we're going to talk about Mahama Care. And President Mahama this morning launched the 3 billion annual Mahama Cares Ghana Medical Care Trust Fund to support Ghanaians battling chronic and life-threatening illnesses such as cancer, diabetes, stroke, and kidney failure. Non-communicable diseases, feel like, accounts for 45% of deaths in Ghana, with cardiovascular issues and cancer making up 19% and 5% respectively. Now, according to that's according to WHO. Now, patients typically need about 50,000 cedis for treatment. Speaking at the launch at the Ghana Medical at the UGMC, President Mahama called the fund a symbol of renewed hope for thousands burdened by chronic illnesses and the high cost of special care.
Today, we're launching more than just an initiative. We're launching hope. Hope for thousands of Ghanaians living with chronic diseases. Hope for families battling the overwhelming cost of care. Hope for a future where the quality of life is not determined by one's ability to pay for essential treatment necessary. The Ghana Medical Trust Fund will support specialist-level treatment for a range of chronic diseases, including cancers, diabetes, cardiovascular diseases, chronic kidney failure, stroke, and other complications. It will also progressively expand to cover convalescent care, palliative services, and home-based support. Support from the fund will be based on formal applications, carefully vetted, and will focus on costs not currently covered under the NHIS. The fund will operate as an independent statutory trust, governed by a board of trustees and supported by a dedicated administrative secretariat, third-party administrators, and patient navigators to ensure transparency, efficiency, and a patient-centered service ethic. Initial projections suggest the fund will require approximately 3 billion Ghana cedis annually over the first 3 years. And as was said, the main source of finance is going to come from the NHIL, the uncapped portion of the NHIL. It will also include direct budgetary support from government, voluntary contributions from corporate institutions and individuals, grants, donations, and will also be able to invest in order to raise income, investment income. Strategic procurement measures such as access pricing and framework contracting will ensure that essential medicines and diagnosis are acquired sustainably.
So that's President John Mahama there, and he donated 6 months of his salary to go into the fund. And the minister who is here with me also donated 3 months of his salary. Again, you're welcome, sir.
Thank you.
Mahama Care, what really is this about? You know, last year before the elections, we had issues with whether the state should take up the cost of kidney treatment. And I see it's captured in this, in the ailments that will be captured under. So is this a long-term solution to some of these diseases?
Good. I think the answer of your question is in the question itself. As a country, okay, you would have to look for solutions for prevailing problems, prevailing conditions. If you come to the health sector, one of the disturbing developments in the health sector at the moment is that non-communicable diseases, the mortality attributable to non-communicable diseases is at an alarming state.
Right.
As I speak to you now, we have not less than 43% of our mortality attributable to the non-communicable diseases. So it's we're at a very crucial stage. We need swift interventions. So during the 2024 general elections, His Excellency John Dramani Mahama, typical of him, decided to think outside the box and then promised the good people of this country that he will establish what we call Mahama Cares. In actual fact, the name is Ghana Medical Trust Fund. In order to subsidize the treatment of chronic diseases, such as the cancer, kidney failure, cardiovascular diseases, and all that. And that is not going to be done in isolation because there's something we are also rolling out called the free primary health care. So the free primary health care will now be dealing with the early stages of these diseases so that we don't even get to that complications anyway.
Okay.
And so we'll be factoring processes where we can go to the marketplaces, social gatherings to be even checking the BP of people, sugar levels and what have you. So that will be dealt with at the primary healthcare level. So the primary healthcare will have a link with the Mahama Care.
Right.
And so what we are doing is that we're establishing a fund. You know, it is estimated that a patient with one of these conditions will spend not less than 50 to 53,000 Ghana cedis a year.
A year?
A year.
In even managing it?
In even managing it. You understand? And what it does is that once you are into this condition, most of them are not curable. You have to manage them. Okay? And so we need money. When you get into this condition, it either, pulls you into poverty.
Of course.
Or pulls you into your grave.
But I can give you a typical example where a relation of mine had some kind of a boil.
Good.
She's over 60 years.
Good.
Around the breast area.
Good.
Then she went to hospital. She's been told that they've diagnosed her as, having breast cancer. And the latest is that because maybe when they started, she didn't take closer attention to it. Now, it spread to a point where they have to now they have to cut the true breast away. Already a lot of money is gone into it, and this is even going to...
I like, you see, when you start narrating this story, everybody can relate.
Right.
Everybody in this country. I can relate, you can relate. The president recounted experiences he has gone through.
In fact, his own personal stories.
Exactly. So everybody can simply relate. So at this point, we must look at how we can get people out of these conditions. And you see, it will interest you to know that the statistics show clearly that those with these diseases, majority of them fall within the ages of 18 to 45 years.
18 to 45.
Yes, the most productive wing of the population are suffering. So it means that it will have a direct correlation with the productivity of course.
And I'm wondering whether we've done studies to understand why this category are the most vulnerable.
You see, one of the revelations today, one of the patients spoke, it's also largely due to ignorance. And she said that she was of the opinion that, this is the rich man's disease.
Yeah.
Those who eat, according to her, she used a word like,
exactly.
You understand? And so when we begin to create the awareness, the sensitization, link it with the primary health care, and then after doing all these, those who get into the complicated stage, how the state can come in to help manage the situation, mitigate the effect, so that although you have the conditions, but you can live for quite reasonable number of years. You understand? Some people sell all their property.
Of course.
Sell even their TVs and what have you. So by the time, he's dead, nothing is left behind.
And that's the worst part. You will spend so much and will not even survive.
Exactly. So we are establishing the fund and we are looking at, fortunately enough, His Excellency John Dramani Mahama has uncapped the national health insurance. So now we are looking at that free for, you understand, the money coming from the removal of the capping to take care of things like the Mahama Cares, the free primary health care, and then the withdrawal of the USAID.
Right.
This is what we are looking at. So apart from that, we are looking at corporate Ghana coming to contribute. In fact, today, I developed goosebumps when some people
started donating.
Donating.
I've watched
Professor Aite, who is a pensioner, after speaking, donated an envelope. He even didn't want us to disclose the amount. So Mr. President gave the envelope to me and later took it back. And he wanted to know what this pensioner at all, how much at all can this pensioner give.
And the same person was also part of putting this thing together.
It will shock you to know that that pensioner donated $1,000 to this
for the program.
$1,000.
And I've also seen Mr. Seydou Agongo 500,000.
Yes, so a lot of people have even called me, and within the next 72 hours, we will announce a short code where everybody can also contribute to, realize this wonderful initiative.
Okay. But the question is, some of these ailments are already captured under the National Health Insurance scheme. So how
legitimate concern.
Yes,
so
exactly.
What we are doing is that we are trying to take off from where National Health Insurance ends.
Okay.
So whatever National Health Insurance covers, Mahama Care will not cover that aspect. So we are coming to build on whatever national. You see, if we decide to put everything on the National Health Insurance scheme, it will collapse.
Right.
And these are very expensive treatments. So we decided to take a portion, go look for funding from elsewhere, combine them, and then begin to run that scheme to provide relief to, families with these chronic diseases.
And so the government contributions is a 3 billion Ghana cedis.
Yes. So now it is in the initial stage. We need about 3 billion Ghana cedis for the next first year. Second year, we need about 3 billion. So yearly for now, the projection, just like the National Health Insurance, once, we run the scheme, we realize that we can add on more diseases. So they were adding on and adding on. But for the initial stages for this chronic disease, the cancer, the cardiovascular diseases, we need about 3 billion. And that 3 billion, we are taking a percentage from the uncapping money and then go look for the rest somewhere.
I've spoken to doctors on this show, and from Kolebu especially, and sometimes they are so alarmed at people who are dying from cardiovascular diseases. And then they trace it to the fact that lifestyle changes, people not eating right, and the stress that people are going through are the major cause. As we seek to cure them, what is the plan to deal with it at the base before it gets to a place where we have to rely on Mahama Care to deal with the matter?
So that is why I initially mentioned the free primary health care. Okay. And so you have to start checking your pressure. You have to start checking your sugar level. You have to start doing ECG to know how your heart is functioning and all that. So that if you're able to detect it early, you'll be able to do something about it. So that will be connected to the primary health care, which of course at the CHIPS level, the health center level, that will be free. So all these things, and those, by and large, those ones will be borne by the National Health Insurance scheme or fund. And
so if at some point this is fully operational, what will be the process to apply for support from the fund?
Okay, so what you would do is that you must be a Ghanaian, and then you must be diagnosed, and at least you must go for a second opinion to be endorsed by at least 2 medical doctors. And all these processes, your medical doctor will assist you. Then you add the relevant documents, your health, whether you have been referred or something, you add them to it. Then you fill what you call the Mahama Care forms, application forms. So when you fill, you submit. When you submit, maximum 2 weeks, you receive a reply.
Okay, and this will manage separate from...
Yes, it's a statutory body. So we have a statutory trustee that will run the fund and manage them. In some cases, we have to invest some of the money to get some dividends for it to grow and all that. So it will be managed separately from the other funds.
Okay, and when do you expect that it will become fully operational?
Well,
after the launch today?
Yes, very, very, very soon. Because at the moment, the policy document is ready, the bill is ready. Immediately we come from recess.
We're going to put it before Parliament.
We're going to put it before Parliament. There's a dedicated source of funding ready. We are going to pass the National Health Insurance formula for 2025, and that money is available to take care of it. So very, very, very soon.
Someone is asking whether there's been piloting has been done on this, or after the launch, is now that you want to see how this will be rolled out?
Well, we have had cases of this nature for a very long time. In fact, in some cases, people even make some appeal to National Health Insurance to see whether out of the scope we can even assist them. So we have experienced, we have spoken to the experts in the field. We even did a survey. About 3,300 people responded to the survey. You understand? And about 79% of the people clearly indicated that it is necessary. They are even ready to contribute and all that. So we've done I mean, a lot of work on it to indicate that clearly when we start the operationalization, we'll be on a good path.
And I heard Professor Adenu from the Physicians and Surgeons talk about the fact that currently we need over 60,000 specialists. If this is going to succeed, we need people in readiness to give that care that is required. And currently we have a huge gap. I don't know what the plan is as you lead this very important ministry to address this, specialist absence in our healthcare delivery. So
at that point, when Professor Adenu was talking, then the president turned to me and asked me whether or not I'm right. So it is something we are going to take up seriously. I'm constantly in touch with Professor Adenu, and he has brought forth some other proposals. We've also listened widely. And one of the proposals is to be able to make the other regional hospitals, upgrade them, make them teaching hospitals, so that they can train more of these specialties. And then it's doable.
Okay.
And we'll be looking in that direction to double in order to fill the deficit we have at the moment, because there's a huge deficit when it comes to the treatment of chronic disease, especially at this complicated stage.
All right. So, but you have inherited quite some challenges at the ministry.
Yeah.
Agenda 111, I don't know how you are dealing with it.
So Agenda 111 is very popular in this country, and as I have always indicated, we have health infrastructure deficit in the health sector, but unfortunately, the way Agenda 111 was started and operationalized, or if you like, implemented, was not the best. And so it has left a lot of challenges in the sector. Initially, it was at the presidency, but now His Excellency John Dramani Mahama has brought it back to the ministry.
Okay.
And so he has access that we should what do you call it? We should audit the whole Agenda 111 project, because at the moment, not less than $400 million have been sunk into this project.
Right.
Meanwhile, not a single one of them is in operation as I speak to you. Okay. If we had decided that we're going to stagger the construction of these hospitals, this $400 million alone, $400 million alone, would have completed not less than 20 of these hospitals, and it would have been in operation by now.
Right.
And so it's a huge challenge. We are assessing the situation. What we need at the moment is a way forward, a solution, which...
The last time we heard about it, the figure was mentioned, $1.7 billion or something. Is this still the figure you are working with?
So the overall figure for the completion of all the projects was around between 1.7 to 1.9 billion, okay? And now, out of it, about 400. So we need between 1.5 to 1.7 billion dollars to be able to finish everything.
And how are we going about funding or
yes, so that is why I don't want to preempt the audits and then the blueprint Mr. President has asked us to furnish him. But we are doing the auditing, and Mr. President has already made some public pronouncement about taking the public sector on board. For example, CHAG. He made the stakeholders in CHAG and told them that, look, you can come on board because for all these years, you've been partnering government so well. If you go to these facilities, government is paying for the compensations of nurses and medical doctors. So we've been partnering. So we'll bring them in, but we have to do the auditing. The auditing will then advise us or will guide us as to the way forward.
So much interest in the Mahama Care. Someone is asking, is sickle cell covered under the scheme?
I've not heard sickle cell for now. But as I told you, it grows. National Health Insurance, we didn't used to have this number of diseases, okay? But now it's growing. So now what we are focusing on, what has been the conversation, is about the kidney failures, the cancers, the cardiovascular diseases.
Right.
I mean, the hypertension-related disease and all that. So as it grows, we'll see what we can do.
We are wrapping up. We got a statement about entry to nursing training. Can you clarify it for me? Because people,
so
I'm getting so much text also on that as well.
When they get you on the platform, they want to ask you almost everything.
It's like you're asking questions on the floor.
That's good. So yes, this year we are going to begin to sell the forms for the nursing training colleges, and we have reduced the cost sales of the forms. We've reduced it from 200 Ghana cedis to 150. So we're supposed to even start the sales, I think, around 22nd, when we realized something that we can do something better than what we came to meet. Why would you have to walk or transport yourself from Hemiha to Dwaboso to come and deposit 150 Ghana cedis in ADB Bank.
Right.
So there's a way you can sit at the comfort of your house and then just go online and buy and fill.
Okay.
So that's what we are looking at. And we are almost done. And by the 5th of May, we will, communicate the sales of the forms and how people will be able to access the forms. And that will be an easier way of going about it than paying a TNT of about 100 Ghana cedis to go and deposit
it makes no
150.
sense. It makes no sense.
It makes no sense. So we have improved upon the system, and I believe that Ghanaians will bear with us.
Finally, have you broken bread with your friends at the Tamale Teaching Hospital?
No, my friends are now doing amazingly well. They are working and everything is fine.
Everything is fine. All right. And I'm guessing under your leadership, we didn't see a lot of industrial issues on our health front.
We'll do our best. We'll do our best. This is a sector. We have more than 80 unions.
Under the sector?
Under the sector. You are dealing with more than 80 unions. So each and every union has its own peculiar circumstances,
right,
what they want and all that. So we'll be humble enough to work with them. We'll work closely. And I've always told them that union leaders will have to work with people in authority to find solutions to the challenges their members are going through. So we all have to work together.
All right.
That's all.
Honorable, we are with you.
Thank you very much.
I hope that you research the health sector.
Thank you very much. That's the deal.
Kabla Kando is the health minister. And folks, that's our show for today. For more stories, log on to our website, manjoonline.com. We've got an extensive discussion on this matter, on Top Story, and of course on Newsnight, plus the Ghana Bar Association latest statement. The current President Mahama's suspension of the Chief Justice as unconstitutional. All that come your way in subsequent bulletins. My name is Elton Roby. Have a good evening.